Hello, my name is Tori Wiley, and I'm a student pharmacist at Xavier University of Louisiana. I would like to thank contributing authors from the LaHealthCom group and the grant support for this research from the Xavier University of Louisiana Research Centers and Minority Institutions Program and the National Institute on Minority Health and Health Disparities and the National Institute of Health. I have the honor to present our project, Development of a COVID-19 Communication Training for Healthcare Professionals Using a DELPHI Approach. As a background, prevention and treatment of the coronavirus disease continues to be a clinical and public health challenge. And those clinical challenges are heightened when healthcare professionals communicate and care for vaccine-hesitant individuals and vulnerable populations. Although existing resources are available, healthcare professionals still have a limited number of tools needed for effective communication. Therefore, the objective of this study was to gather information to develop a COVID-19 training to equip healthcare professionals to communicate effectively with vaccine-hesitant and vulnerable populations. The methods of this study included identifying healthcare experts based upon a review of the literature and the use of a DELPHI study approach. The expert participants were invited to participate in an online questionnaire. Data collected included demographic information and responses to open-ended questions regarding vaccine hesitancy, cultural competence, and health disparities. Team members analyzed the data by creating domains of meanings and reaching consensus about commonalities and divergent themes. Each theme was conceptually defined and the findings were summarized. The characteristics of our DELPHI panel experts included participants from multiple disciplines with more than 15 years of experience in previous multicultural or diversity training. Of the subject areas that were included in the online questionnaire, the divergent themes of the responses included equitable patient considerations, which was defined to take into account a patient's values, beliefs, background, educational level, language, impairments, and influences without judgment while providing the highest levels of care to diverse populations. The other theme was the use of a healthcare professional toolbox, which refers to the cultural awarenesses, knowledge, behaviors, and social action skills that healthcare professionals have at their disposal to demonstrate when working with patients of diverse backgrounds and experiences. These are internal and external resources for healthcare professionals to have agency over their personal and professional environments. Furthermore, equitable patient considerations had 3 sub-themes identified, including clear messaging, informed patients, influencers, and equity. The healthcare professional toolbox had 2 sub-themes identified, including healthcare professional competency and healthcare professional vulnerability. Overall, the results of this survey made us identify essential components to educate healthcare professionals that incorporate cultural competence in addressing health disparities. Further investigation is needed to ascertain best practices and additional educational modalities that will better equip healthcare professionals with increased knowledge, patient-provider communication strategies, and clinical practice skills when interacting with COVID-19 vaccine-hesitant patients and vulnerable populations. Thank you.